I'm Dr. Dave Janda. Welcome back to the Insider Insight Show. I am honored to have you back as a viewer, and I'm honored to have Tom Renz back as our guest. Tom Renz is an incredible freedom fighter. He has been fighting for your freedom for actually decades on many different planes. But in particular, over the past 3 years, he's been fighting for your healthcare freedom and for you to have the real facts, the real data, and the real science about what you, every American, and every person of the world has been going through. Tom Renz is one of the very few people in life that have the courage, the perseverance, the dedication, and the sacrifice to hold each and every member of the syndicate's feet to the fire of truth and, based on what he does as an attorney, to justice. A little background on those of you not familiar with Tom Renz. He is an attorney. He is the lead attorney in several cases brought in Ohio, New Mexico, Maine, and nationally against the CDC, the Department of Health and Human Services, and even someone I won't even put the word doctor in front of, that being Anthony Fauci. And his suits have been focused on the forced vaccine mandates, big tech censorship, the COVID-19 lockdowns, mask mandates, business closures, false PCR data, fraudulent death numbers, and much more. Attorney Tom Renz works and represents America's frontline doctors, Make Americans Free Again, and Ohio Stands Up. His website is renz, renz-law.com. It is my honor to welcome back my friend, a friend of every person who views these videos, and a friend of every person in our country and the world, Tom Renz. Tom, welcome back to the Operation Freedom Show and platform.
That's so you're so kind. I'm really honored to be able to fight this fight. I mean, it's tough a lot of days, and it's not an easy fight, but it's a necessary fight, and it's a privilege to know that I got guys like you helping us to do it, and we just keep soldiering on, and we're making great gains.
We are making great gains, and the syndicate does not want people to realize it.
No,
Tom,
they
I want to start our interview off with a quote made many decades ago by George Orwell, the author of 1984. But this is something else he said. Quote, "All tyrannies rule through fraud and force. But once the fraud is exposed, they must rely exclusively on force." End quote. Tom, you have been relentless in fighting the fraud and the force that is put behind that fraud as you and others have exposed it. Tom, when you look back now over the past 3 years, what are the first 2 or 3 things that come to mind of the biggest frauds that were perpetrated on the worldwide public about COVID?
I mean, number one, and I don't know if this is necessarily in order of the biggest or more chronological, but I mean, when we look at the initial lockdowns and everything about that, the fear that they were pushing. I started researching this disease back in December, January of 2019, 2020. And the reason that I stayed on it was because everything that they reported in the news was a lie. Like when I'd look at the numbers, when I'd do the research, it just nothing that they said was matching, right? So, the idea that they could lock entire states into their house and essentially say the entire population of a state is under house arrest because there might be a germ out there that might cause you problems. That is one of the greatest overreaches and one of the most mind-blowingly horrible actions ever taken by the American government. It's just an anathema to our Constitution and freedom. I would say that was probably the whole premise. That this, I mean, by the way, the numbers all pan out, even without early treatment, which they've been denying since day one. COVID is really not much more dangerous than the flu for most people. It really is not. And that's without treatment, you know. So that would be one. The second one, which is equally as big, I would say, if not bigger, but was more surprising to me, and I think that's going to be a shock to a lot of people, are the vaccines. Mm-hmm. I was pro-vax. I mean, when this started, I remember a few years back before this started, you know, my wife comes in and tells me, hey, this lady from Hollywood's talking about the connection between vaccines and autisms. And I said, that is the stupidest thing I've ever heard. Do you really think the entire industry would cover this up? Well, you know, but I'm an evidence guy. I followed evidence. I found out everything about these vaccines, these COVID vaccines, is a fraud. And so, you know, while I haven't researched every vaccine out there, I certainly am suspicious at this point of every single one of them, because the amount of fraud and the extent to which they've lied in these is so mind-blowing. I can't even fathom. And, you know, in a little bit down the road in the show, I'll show you some new numbers that we just dropped this weekend. Although you might not have seen it because they cut the feed right before I did my speech.
So shocking.
Yeah, Verizon actually cut the feed about 15 minutes before I went on stage. Who would have ever thunk it? Right. But you know, the numbers pan out to show that this is the most dangerous product probably in the history of consumer products. And if I had to list a third, boy, I think it would be the kind of a more overarching lie. The whole premise of public health. As I've looked at this, and you know, I was working on a master's in health science when this started, and you know, so I took my public health classes. The concept of public health to me always seemed real good, right? You know, let's keep people healthy. But when you look at what they teach in the classes, what they teach is collectivism. The value of the many exceeds the value of the one. And that's an anathema to the U.S. Constitution, to the founding of our nation, and to what we believe as a people. Individual rights have to be preserved, right? You know, when we see police brutality, we have marches, we have riots, we have all these different things, even when it's questionable whether it's true brutality. But we do that because the rights of the individual were stomped on. Now, it doesn't, even if the rights of that individual, even if that individual is a criminal, we believe that individual's rights have to be preserved. Public health believes the opposite. If you have to sacrifice your individual rights for the health of the greater, then that should be mandated. Here's the thing, and here's where it tricks people. From a moral perspective, I agree that I should do what's right to try and take care of other people. Mm-hmm. But we can never, ever allow the government to have the power to do that. Mm-hmm. Because if the government can mandate it, then the government can control everything, and the government doesn't get to decide what's right and wrong. Mm-hmm. I can do it because it's the right thing to do, but I get to make that moral judgment myself. With public health, they believe it's the government's job to decide what it is. So what? Does that mean we outlaw McDonald's because it makes people fat and they die from it? Do we outlaw Slurpees? Do we outlaw large sodas like they did in New York? Where's that line? You can never cede that power to the government. We have to teach what's right and wrong. Individual responsibility is the only way that freedom works. You have to have people trying to do what's right, but it has to be an individual choice. It can never be mandated.
Well, it's interesting Tom. It's interesting when I first went to work in healthcare policy in 1988. It was for when I saw a lot of my work in prevention and wanted to have it integrated in healthcare policy. And when I went to D.C., I started working with then Surgeon General C. Everett Koop. It's interesting the conversations I would have with Dr. Koop, because Dr. Koop was really the Surgeon General that pushed for the warning label on cigarette packs: smoking can be hazardous to your health.
Yeah.
At the time, he said, Dave, they wanted me to come out and push for it to be illegal to smoke. He said, no. He goes, that would be contrary to what this republic was founded upon. Yes. And people need to be warned if there are problems with a entity, a product, or whatever it might be. But it should be their own individual choice on how they handle it. Well, let's take that now to the present day. One of the big problems, Tom, I had with the entire COVID goat rodeo, or whatever you want to call it, was with the jabs, and in particular, with the lack of comprehensive, informed consent. You see, just as Coop taught me, look, Dave, you got to point out their problems and let people decide. One of the big problems I have, Tom, and maybe your experience is different when I talk, and I've talked to thousands of people that got the jab, and I asked them about what were they told about the potential risks and complications. The answer almost universally was, I was told to roll up my sleeve.
Yeah. Yep.
See, and that's, I believe, Tom, in my world, along with the lack of early treatment, which is contrary to the 32 years on the front line of healthcare delivery that I was involved with, and if you add all my training, over 40 years involved in healthcare delivery, where early treatment was the gold standard, the fraud of no early treatment and the fraud of no comprehensive informed consent, Tom, I believe killed millions of people and put billions of people in harm's way because of those two entities.
I cannot argue with any of that. And in fact, so prior to this weekend, I've been very, very busy this summer working on, I actually had to be a lawyer now and then. And I also had not been putting out a lot of new data. Part of the reason is that at this point, I think there's so much data that I don't really need to put much more out unless it's super, super big, because at this point, if you can't look and see what's there, you're not looking. Mm-hmm. So, I think that there's plenty. But this weekend, I did have some stuff that was so important that it needed to be there. But, we know, going back to October of 2020, when the FDA did its VRBPAC presentation that was leaked online, they knew of a whole list of side effects that weren't in the warning sheet. They expected these. They talked about that they were going to monitor for them because they knew they were an issue. Yet they didn't make it into the list of things for informed consent. So you know that these are going to be an issue. You're concerned enough about it that you're going to monitor for it, and then you're not going to warn anybody? If this was anybody but the federal government, they would have been sued immediately under products liability. But they, because they're the federal government, they're immune. And that's what they've done. And that's why the emergency is ongoing, because they need the emergency so that they can protect these crooked jab people from having to disclose the truth. But the reality is that they've known this from the beginning.
Yes.
And they hid. Instead of providing informed consent, they hid informed consent. 9 pages of adverse events of special interest on the Pfizer document. 9 pages. Thousands. And yet, not a peep about any of it. We see the hepatitis outbreak related to adenovirus. All listed in the adverse events of special interest list on the Pfizer vaccine. Of course, no one wanted to make that correlation until I did. Then suddenly it disappeared from the news.
Right.
We see monkeypox. There are, 50 different types of herpes that you can get from these that they're looking at as adverse events of special interest. In fact, when some of this stuff came out, I did an article. Can the jab give you a herpes? And people looked at me like I was nuts, except for I pulled it from their data. Now, I'm not saying that monkeypox is herpes, but I'm saying that if you've got lesions developing and they're putting out there that, monkeypox is an epidemic or pandemic, and, someone just looks at it and says there's lesions. Well, unless they do the laboratory testing, a lesion's a lesion. It could be one of any, there's more than one disease that creates these sorts of lesions. And unless you do the laboratory testing, it's real easy to misdiagnose. But, I believe, Dave, that from the beginning, one of the major plans here, and I think this is why I will go out and say that we've won this as long as we keep fighting. But I say that because from the beginning, I believe, they knew all these side effects were there. they had to get to 90 to 95% jab for this to work, right? And they did everything they could to force that. But we fought really hard, all of us did. And so if you believe the CDC, which I don't, 75% Americans have jabbed. I think I can't find evidence for much more than 50, but let's stick with their 75%. That still means 1 in 4 aren't. And those 1 in 4 have gone through hell. They've been persecuted by friends, family, and loved ones. They've been fired. They've been just through hell. And guess what? That's enough people where everybody knows someone. And that control group now is mad. So when they see you, the jab guy who was giving them guff because they didn't get the jab, get COVID for the 3rd time, they're going to say to you, hey, you notice I haven't had it, but you're on number 3? It's really a mind-blowing thing to see. And because of this, we now have a built-in group of people who are both a control group and very, very, very loud advocates for the truth. And so as long as we keep fighting and continue pushing this, we'll win it. Now the problem is how long that takes. The truth is coming out, and it's coming out more every day. We see that, but how long? And the reason that's important is every day that this continues, another person dies.
That's right.
And more people keep dying from this jab. And instead of figuring out how to treat the jab and how to treat COVID, we continue to allow people to die from this lie so that these billionaires can become more and more enriched and then hide their money so that we, the people, it's the biggest wealth transfer in human history. It's mind-blowing. So we're winning, but we haven't won yet.
The other group that's become very vocal about what's really going on are people who have either been injured from the jab, who bought into the con, or were coerced, or were both conned and coerced into the jab, and now they are injured or their family members are injured and died. Tom, let's go back. In June of 2021, you presented a whistleblower that went through the Center for Medicare and Medicaid Services data and their tracking system and determined, tell me if I'm wrong, if I'm remembering this wrong, but approximately 47,000 Americans over 65 and above that were on Medicare died within 2 weeks of getting the jab.
It was something to that effect. That's approximately what it was.
And then you presented it when Senator Johnson held his hearing in January of 2022, information from whistleblowers through the Defense Medical Epidemiology Database, which is probably the best database for what's happening diagnostically, what's happening in the field, because it's the reports from it's charts, it's patient charts. It's not self-reporting, it's not for it's the patient charts. You presented data that showed in the military that with the jab instituted, there was a 2,100% increase in hypertension, 300% increase in cancer, 1,000% increase in neurologic disease, a 269% increase in heart attacks, and a 368% increase in blood clots going to the lungs called pulmonary embolus.
Yep. I mean, and to this day, the DOD has refused to respond to that. All they did was say there's a glitch. They wouldn't go on record. They won't give us anybody that we can cross-examine. They won't say it under penalty of perjury. They just say, yeah, there's a glitch, and then let their fact-checkers mimic it. Except for, unless you can give me something more than that, okay, so show me it's wrong. Are you telling me it's wrong by 2,100%?
Right.
Really? Because if you had that big of a glitch, I want to know how much we're spending on that database and why we're spending anything. Mm-hmm. Because if it's that wrong, there's a problem. But since then, a guy named Matt Crawford has done some additional data analysis, and he found some really interesting things in what's called MSMR reports that also show, it just looks like the DOD is covering this up. They're changing numbers. They're doing whatever they can to do this. So I'm also even getting reports of the VA shredding documents So think about that one. Completely illegal. But, from top to bottom, we're seeing corruption on this at every level.
Well, speaking of the top, let's talk about the Secretary of Defense, Austin, right? Double jabbed, double boosted. It's now been announced he got COVID for the second time, and this is the same globalist who has mandated the jabs in all of our armed forces to the point where thousands are going to be pushed away, highly trained, incredibly courageous individuals pushed away because they're saying, whoa, you want me to get something that has all these downside risks? You want me to get something that doesn't prevent me from getting COVID? Just look at yourself. Yep. Double jab, double boosted, and now you got it twice. No. So this is a huge deleterious action against our own fighting forces. Yet he will not back off, at least to date, on that mandate.
No. Well, I mean, and he also is sitting on a board for a healthcare company. I think he made $200,000 in 2020 off of this stuff. He's made a bunch of money off of it. I mean, the guy to me is a crook and a traitor to the military. I think he's garbage. Yeah, and I'll one up you. I'll one up you. You think that's high in the food chain? I don't know if you've heard this. I did some stuff on my Substack on this. How about Hunter Biden? How much is the big guy making off of this? Hunter Biden was invested through his investment firm in Metabiota. Metabiota was listed as a partner with EcoHealth Alliance in the Wuhan lab where SARS-CoV-2 was created. And I said where SARS-CoV-2 was created, not because I'm a conspiracy theorist, but because coming up, I'm going to be bringing that in court. I got evidence. I can't go into the details right now, but yeah, it was created in a Wuhan lab, and our good buddy Hunter, shockingly, was probably making some money off of it. Further, Hunter was also invested in a couple other companies that were involved with, guess what? Ukrainian biolabs. You know, the ones that don't exist?
Yeah, right.
Except for one thing. Those biolabs are listed, or at least they were, unless they've taken them down, on the U.S. Embassy's website for the Ukraine. Mm-hmm. Are you kidding? They're listed there, and these guys still said they don't exist. And here is the real coup. Do you remember in January of 2020 when they were making such a big deal out of what are we going to call this new coronavirus? What are we going to call it? Oh, let's go COVID-19. Okay, remember when they made that big decision?
Yes.
Okay, so they hadn't named it before that, right? Except for one thing. I have a grant document from USAID to one of those Ukrainian biolabs that Hunter Biden probably was making money off of from October of 2019. You know what that grant was for? That grant was for a study on COVID-19.
Oh, shocking.
How could that happen since it didn't exist yet?
Right.
How could it possibly be that in October, because remember, they didn't just make it up on the spot. Someone had to put out a request for the grant. Someone had to put a proposal together. This all takes time.
Many months.
How could there be a grant issued for studying COVID-19 if it didn't exist in October of 2019? Seems to me like there's some corruption going on. And it seems to me that the big guy, someone should be asking where the big guy got his cut.
Meanwhile, the big guy was telling us, Tom, people like you and me that are not vaccinated, we would experience the winter of death last year. Another coercive tactic, right? Yeah. The same Biden, double jab, double boosted, who got COVID twice. His wife, recently double jab, double boosted, also has COVID. Anthony Fauci, the one of the perpetrators of the pathogen coming into being through the gain of function research that he funded, COVID twice. All of these individuals telling us, including the CEO of Pfizer, now double jab, double boosted, Bourla, who has COVID, who assured us 100% certainty that if you get the vaccination, you won't get COVID. All these people are guilty of fraud
Yep.
and coercive force.
Yep. Well, and let me tell you what else. While you're going through that little rundown, let's not forget that when they were telling you how safe it was, that back in, and I can't recall, I don't have it in front of me, but I think in October of 2021, when I've got Anthony Fauci on record in an interview talking about the winter of death and how 90% of the people in the hospitals are unjabbed and that the hospitals are overrun with unjabbed. Meanwhile, I have from the desk of Anthony Fauci a document from Project Salus that says, and it came out, the date was the end of September. So before Anthony Fauci was saying this on air, this Project Salus document, which is from the Department of Defense, was quite simply stated in plain terms that 71% of new cases were in fully vaxxed and 60% of hospitalizations were in fully vaxxed. That number's since gone up, I believe. But so, I mean, we're not suggesting Anthony Fauci's a liar. We're telling you he's a liar because he had this data, unless he wants to claim he was so negligent that he wasn't reading the data from his own people. And he was out there lying. I mean, just barefaced lying. The guy is a crook, he's a liar, and he's a scumbag.
I think that's being diplomatic, Tom.
It was. Being
nice. You're a diplomat by heart.
I wanted to stay away from the four-letter words.
Good point. So, Tom, we recently had some revelations from the CDC. In particular, August 11th, 2022. This was highlighted by NPR, no less, who was pushing the jab and pushing lockdowns and pushing social distancing and pushing masking. All of a sudden, they came out with this report based on the CDC's new guidelines, and here's what they highlighted. NPR.
Yeah.
New COVID-19 guidance from the CDC focuses on, ready for this? Individual decisions. Wait a minute.
They're crazy right-wingers at NPR. Those guys are conspiracy theorists.
Here's the thing. Okay. Here, pertinent changes to the guidance by the CDC. Those exposed to the virus are no longer required to quarantine. So in other words, lockdowns don't work.
I'm going to show you that in a second.
Okay. Second point made. Unvaccinated people now have the same guidance as vaccinated people. Medical translation, I believe, would be the jab doesn't provide benefit. It's not effective. Would you believe that's a fair statement based on what they put forward?
Might be a bit of an understatement, but yeah.
Okay. Third one. Students can stay in class after being exposed to the virus. Medical translation, at least to me, is social distancing really doesn't work.
At all.
Okay. Fourth and final, it's no longer recommended to screen those without symptoms. So in other words, asymptomatic transmission does not occur. And by the way, masks don't prevent getting this pathogen.
In fairness, Dave, and we have to say this. I mean, it did take me until July of 2020 to have all the evidence on this, and then took me till beginning of September of 2020 to file my first suit saying all this. So I mean, you know, it just took them a little bit, another 2 years to catch up with us. But I mean, Dave, can I share a screen?
Please. Can you? Let's try to do this.
Let me share a screen because I want to show your viewers this. Can you guys see that?
We can. It's excellent.
Okay, so I'm going to start out. I want to show you something at the end. So this screen, you should see two graphs on there.
We do.
Okay, so this is the Medicare inpatient stays on the top.
Yep.
And or on the bottom, and then the number of deaths from the Social Security master death file, which I just got access to from a wonderful whistleblower who did this wonderful analysis for me. She's just an amazing human being. These people are awesome. So if you look, you see this green line here. This green line corresponds with the massive death spike that killed everybody when COVID first came on the scene. It was everywhere, right? Now, I'd like to show you, if you look, and the graphs aren't the same numbers, so you can't look just at the size, but if you look, that spike in deaths,
yes,
corresponds directly with the decrease in inpatient stays. Now, what happened then? Everybody was told you're going to die if you leave your house. Don't leave your house. And the worst place you could go is a doctor or a hospital, because if you go there, you're going to be surrounded by COVID people, and then you're definitely going to die. So what happened? Our lockdowns and the fear tactics scared everybody into staying home, and everybody died because they stayed home and didn't get treatment when they were having heart attacks, strokes, and other things. Then, because everything was categorized as COVID, they called it a COVID spike, when the reality is a ton of this wasn't COVID at all. It was people not going to the hospital for treatments they would normally get treated for.
Oh, and Tom, add to it, governors like the governor, the incompetent commandant for the state of Michigan, the largest POW camp in all of North America, Gretchen Whitmer, was sending at the time COVID-positive patients to COVID-negative nursing homes, killing thousands in the state of Michigan, of which she then and her agencies all tried to cover up the data.
Sure did.
Sorry to interrupt.
Sure did.
Yeah.
But I think that this is a very, very mind-blowing. Now, I want to tell you this, and I'd like to show you, with your permission, a couple other graphs on this.
Hey, Tom, tell folks. So you see where that spike is, where your green line is. That's the big, COVID hit, everybody's dying. Well, when you look further down the line, Tom, there are even bigger death spikes, right?
That's why I want to show you some other graphs.
Good.
Because those big death spikes are really important here.
Yeah, they are.
Now, I'm going to scroll back a few slides here. This is SSA master death file for all ages, right? Oops. If you look at this,
Tom, explain to our listeners what SSA means.
So this is the Social Security Administration death file.
Yep.
Now, the Social Security Administration has the best death records in the country for everybody. It's not just old people on Social Security. It's everybody. And they're not perfect. They don't capture everything, but they capture a vast majority of things. These are probably the best records we have. Here's why these numbers are so important. You've heard a couple guys come out, and they have some great stuff. From some of the insurance companies and elsewhere talking about the spikes in excess deaths over the years.
Yes.
The problem is Anthony Fauci and the FDA and all these scumbags can say, well, we don't have insurance data, so we don't know. This is from the government database. This is something they have to be looking at. You can't monitor the safety and efficacy of a national pandemic without looking at how many people are dying. So they're looking at this. They can't deny that they looked at this. So let me show you what you need to look at here. And is my cursor appearing on the screen?
Yeah, you're good.
Okay, good. So right here is the spike. This is, that April-ish area where, we had the lockdowns. Everybody in the world died 8 times from COVID, and, it was the worst thing ever. Except for the reality is that most people were dying because they weren't getting treatment, as we showed in that previous slide. What do you see here? This is the highest death spike. Going back to 2010, this is the highest death spike on record. So this coincides with the initial authorization of the jab. The jab was then, immediately after it was authorized, given to every senior. Remember, there was a huge push to vaccinate all the at-risk people in the nursing homes and all the other people who were at risk. In fact, they were saying, listen, we got to put this out by need, and so we're going to give it to the elderly and the sick and the weak first, right? What this was the kill-off of all of the people who were weakened, because the more susceptible, I would propose that the more susceptible you are to COVID, the more at risk you are from COVID, the more at risk you are for these jabs. The jabs create a spike, just like COVID does. It's the same mechanism of injury, so it would make sense. And they also do other things, apparently. But so if you compare this, This spike dwarfs that initial spike that they were all paranoid about that was caused by nobody getting treatment and lockdowns, but yet they continued on with it. And you see that it dropped down because after this initial wave, people quit getting it. Then you see we get to the boosters and we get to other things and mandates, and it spikes back up. Mm-hmm. Now, one of the real interesting dates I'll show you on this slide. You see how there's this other spike here? Mm-hmm. Well, if you look at the date, it's around the time that school started. Now, this is 18 to 40-year-olds. You notice that there was no major spike, and then you got COVID coming, there was a few deaths. But then the big spike in that age group occurred around here. So this is when the mandates were largely being pushed, and also when anyone that wanted to go back to college or to school or anything else had to get the jab or they couldn't go. Mm-hmm. So a whole bunch of people from 18 to 40 went and got this, and then they all died. I don't know how else to say it. Now, in case this isn't enough, this one shows people over 65. So you have the spike from nobody getting, and you notice that this spike didn't occur in the 18 to 40-year-olds. No. It only occurs in the older because these are the guys who didn't go for the heart attacks. Mm-hmm. They stayed home and had died. Mm-hmm. But the bigger spike occurred when they started jabbing all the old people in the nursing homes, and then when you see spikes with boosters and with when boosters became available and other such things, right? So this all very much confirms or correlates to, I guess would be the better way to say it, demonstrates a very strong correlation between increased jab and increased death. This slide shows numbers. It's easy to see, right? So you've got the number of deaths in 2020, which should be the highest number on record because that's when the pandemic was.
That's right.
And remember, everybody that got this in 2020 should have had natural immunity for 2021, mm-hmm. So the numbers should have dropped dramatically. Mm-hmm. Instead, in 2021, when you see the jabs come out, look at the increases over 2020. The only month there is a decrease is the month that correlates to nobody getting the jab, which was July. Every other month, 29%, 31%, huge increases, and yet they continued to approve this for younger people. They knew, Dave, that this was killing people right and left, and they kept pushing it because they didn't care. They were only worried about padding their pockets. They didn't care how many people died. They didn't care what it meant. They just kept padding their pockets. And by the way, you want to know how dangerous this pandemic was for young people? Here's SSA for under 18. Do you see any spike at all here when COVID started? No, you see the death numbers crash. This is not dangerous to young people. The only time you see a spike is here when the jab started being available for younger people. Get the jab, get dead. That's the moral of this story. I mean, it's clear as day. We've got more numbers here. This is the under 18 numbers. See, the numbers went down in January, February. Then when the jab started becoming available, the numbers go up. Mm-hmm. Even for young people, get the jab, get dead. You give it to your kids, you're poisoning them. And I pray if you've done it because you got suckered into this, I'm going to pray for your family because the long-term side effects are still unknown, but we know it ain't good. So, I mean, when we look at this, it's, this stuff is incredibly damning.
It is.
There's zero question. I mean, Fauci had this info.
Yes, he did.
There's no question. I mean, you worked with Coop. Are you telling me that you guys didn't monitor the master death file?
Let me tell you something. He was like an air traffic controller. Okay? He could pick out a trend before almost anybody else in the room.
Yep.
Right? And he taught everybody how to pick out a trend before anybody else in any other room that you're ever going to have your entire life. No, Tom. That's why people say, Janda, you're really hard on Fauci. You're really hard on Birx. You're really hard on Pence with his COVID task force. You're really hard on Trump. You're really hard on Biden. You're really hard. No, Tom, I don't think I am. I just think I'm realistic. Because I know what they had. And I know what they willfully underline willfully, ignored to the peril of every person in the world. So, Tom, here's my question to you, Tom. Why do you think they willfully ignored this? Why did Trump, why did all of them, and to this day, have not said one word about the hazards of the jab? Why?
So, in terms of what happened over time, I mean, we have Deborah Birx who openly admitted to lying to Trump.
She did.
So I don't know what Trump knew at the time. Now, why he hasn't spoken out since is beyond me.
Right. Me too.
I don't know.
No.
I mean, listen, this is killing a lot of people. He did some magnificent things in pushing this through, but he thought he was doing right. He wasn't.
No.
It wasn't. It was a disaster.
Right.
And it's not, you have a bunch of guys. But listen, don't tell me that this wasn't planned when I have the October 19th
That's right.
grant that shows that they were studying COVID-19 before they ever knew this. You know what? I'm going to go out on a limb here, David. I don't think I said this publicly, but I'm going to tell you guys what I think. Mike Flynn, General Mike Flynn, guys, I know him well. He's a hero.
Mm-hmm.
This guy, when he was working with Trump in 2016, stated that one of the first things he was going to do is audit the Black Book projects.
Mm-hmm. Exactly.
Now, do you know what that means? Is the CIA, DIA, these intelligence agencies, they run a ton of money that isn't really tracked or traced by Congress. And they do it under the guise of national intelligence, national security.
National security, yeah. Mm-hmm.
Trump ran DIA, so he knows how this works.
Flynn. Mm-hmm.
Flynn.
Yep.
Yeah. And so Flynn was going to look at this.
Mm-hmm.
I have never in my life seen, nor could I point to another instance where anybody was attacked in the most ridiculous way ever that compares with what happened with Flynn. It was ridiculous. Even when the DOJ wanted to drop charges, the judge was still trying to do something. It's ridiculous.
Mm-hmm.
So this was absurd, but I think they had to get rid of him. Now, the evidence, I had mentioned that we were going to talk, we're going to be bringing into court. Now, this disease, SARS-CoV-2, was created in 2015, I believe. So had he done this research, some of this stuff would have probably came out. This has been planned for a long time. Now, we haven't got to the point where I can prove this yet. But I do feel that the evidence is pointing to the fact that we're going to be able to show that they had to get Flynn out of there, because if Flynn had done a Black Book audit, he would have found out about some of this corruption and probably a whole bunch more corruption. What they were doing, transferring science and transferring knowledge and all this stuff that they were transferring to the Chinese Communist Party, when they, going back to the 90s, China's talked about using biowarfare against America.
Mm-hmm.
To transfer that sort of technology to them is just, it's unfathomable. And that's precisely what we did with these gain-of-function grants that Fauci was supporting through EcoHealth Alliance and other such things. So I think that they had to get rid of these guys. I mean, I'm speculating a bit here, but the evidence keeps pointing this way.
Mm-hmm.
And, the fact that from there, I personally think that Trump should have came out by now and he should have said, listen, these guys have lied to their teeth every step of the way.
I agree.
And you need to get away from this because it's poison. But he hasn't. Whatever. Biden, to his credit, he said, he wants to make it right by the military. He wants to help. Meanwhile, Biden's still throwing soldiers out.
Right.
He's still trying to push this.
Right.
And still, I'm guessing, looking for his cut. And a new diaper because he doesn't seem to know where he's at and seems to need one. That's probably terrible and inappropriate, but
it's actually it's a point of fact.
It probably is.
Yeah.
But I don't know. I mean, I just view the whole thing as corrupt from beginning to end, and I think it's shameful.
So, Tom, take our viewers through where you think, because you are very much on the inside of this. Tell us, if you said to the vast majority of people that the CDC would be coming out with new guidance And what they said, what we already outlined, people say, "You're crazy, man. You're just off the nut. You are off the rail." Well, here they are. Okay, Tom, take us through the next 6 months to a year that you believe what's going to unfold. Because Tom, what the CDC did on August 11th, that wasn't a mistake. They wanted to kind of get ahead of what's coming, right?
Yeah, no, they know what's coming. I mean, we've because I knew that the development cycle and some of this stuff I'm doing is so long.
Mm-hmm.
I mean, for the viewers, I want you guys to understand, I work 24/7.
Yeah, you do.
But some of this stuff is just uber complicated and takes forever to develop.
Mm-hmm.
And I'm in so many different spots, it's just hard to do. And so, I knew that the development cycle on some of this stuff was going to take a bit. So, I telegraphed a bit, and it was a measured risk that I did. I did that knowing that they would try and get ahead of it, but also that it was going to force some reaction. And I need people to have the opportunity to see freedom and to see truth as quickly as possible, because every day that goes by, more lives are lost. So, there's always this kind of chess game going on. We're always trying to figure out what to say, and they're doing the same thing. And, so we telegraphed a bit of this. Now, I know what I've got. The stuff that I got is damning. And it's going to be coming out, and it's really, a lot of it's incontrovertible. And a lot of it's going to be very critical in the courts and elsewhere. And I think there's a lot of people trying to get out of the way of it.
Mm-hmm.
And I think at this point, if I were advising the people on the other side, I would say that's a good decision,
mm-hmm.
because it's coming down. Now, I think what we're going to see from the other side is, how do we limit the long-term damage to truth coming out? How do we ensure that when people start waking up to the reality that this entire COVID thing was a fraud, that they don't start questioning some of the other lies we've been perpetrating? How do we make sure that it's not that we keep it to a few guys maybe going to jail rather than everybody going to jail? How do we ensure that our global cabal, the syndicate as you call them, that these guys, that they're not all held accountable? And I think what we're going to see is a lot of back and forth. I know from my end what I'm preparing for, and guys, go ahead and take your notepads out if you're on the other side. What I'm preparing for is how to make sure that we get accountability for the jerks and the monsters and the murderers behind this. How do we get to the people who are really, some of the core players and to the heads of the snake, right? I've got mechanisms, methods, ideas, theories, all sorts of things that we're working on. I try and stay a step or two ahead, which is, Dave, do you know how ridiculous it is for me to say this? I am in my office in Ohio, in this little town. I now have the privilege of having a few employees, but they work in different states and in different cities. We're all over the country. We're doing all these things, but for God's sakes, I'm a nobody. I really am. And all credit and all glory to God that I've been able to do anything like this. But we really are working on strategies to make sure that we're undermining and making sure that accountability goes where it needs to go. We know who did what.
Right.
It doesn't mean we can prove it, right? So what we got to do is we got to take the steps that we can to move the ball down the field, always looking towards the end game of accountability for the people who are actually behind it. And we've been doing that for a couple of years now, approaching 3, and we're going to keep doing it. And we're going to get there. There will be accountability, and I look forward, as this lie continues to become more exposed, to helping to educate people about all the other nonsense that I found along the way. Because, you think that this COVID thing is shocking. Wait till I start telling people about the connected issues and the connected things and all the things that the same players are doing.
Mm-hmm.
Because when you're researching far enough, you find out they're doing this too. Mm-hmm. I never even cared about that issue, but I guess we're going to go there. So I'm looking forward to it. By the way, I'm very well adjusted and happy. I don't have any suicidal tendencies. I love life.
It makes two of us.
So, but joking aside,
Well, and Tom, to your credit, I believe because of your efforts, along with frankly too few others from the beginning, there should have been many, many more in the medical profession and in the legal profession stepping forward that did not. The public is awakening. And they're awakening because either they, as you said, stood their ground, the 25 or 30 or 40% that stood their ground, those that were harmed, those that saw family members harmed, are awakening, and they in turn are awakening others. And they're asking a lot of hard questions for those that coerced or conned them into a very bad decision. And a good example of that, Tom, is a couple weeks ago now. Anthony Fauci was in deep blue Seattle, thought he was going to be welcomed as a conquering hero to the Seattle Mariners game to throw out the first pitch.
Yeah.
And he was greeted by mega boos. People screaming at him, booing him. And right then and there, Tom, I came to the conclusion that we had gone beyond the tipping point. If this occurred in Florida or in Texas, I'd say,
Yep.
oh, well, interesting. This occurred in deep blue Seattle, home of Billy Gates and all his other crew. This occurred in deep blue Seattle. And right then and there, Tom,
Praise God.
I realized we had broken the point of no return for accountability for these totalitarian thugs.
Praise God. I got to tell you, we're going to get to a point where we're going to say, you know what, it's one. I don't know when exactly that will be. But, when you just said that, the thing that came to my heart and my mind is what that's going to mean for me. Is I have given everything.
I know you have.
That I have on this.
Yes, you have.
My family's time, my time, my heart. I've given everything I got on this fight. At the end of the day, and I said this a while back, win or lose, I left it all on the field.
Yes, you did.
Now, I don't know at the end of this whether anybody looks back and says, Tom, you really had a big hand in this, or whether it's, Tom, we appreciate what you did. At least you showed up. Doesn't matter to me.
No, I know.
For me, from my heart, I left it all on the field.
Yes, you did.
I didn't have any more to give.
Mm-hmm.
And on a daily basis, I mean that from the bottom of my heart. And I do believe we're going to win this. And I do believe that we will have saved lives. And I do believe all glory goes to God for letting me have a hand in it. I never deserved that. I still don't, but I'm glad that I did. And I'm going to look back on this, and I'm going to sit down, and I'm going to raise a beer with as many of my friends, you and anybody else I can, and I'm going to toast the fight, because it was one hell of a fight. It was painful. Mm-hmm. It was difficult. Mm-hmm. It damaged me, damaged the people I love, mm-hmm. but we fought it, and we fought it good. And at the end of the day, for a guy like me, I think that's all you can ask for in life.
I agree with you, Tom, 110%. And this is a win, not just for all of us who fought from the beginning on this. It's a win for our republic. It's a win for our society. It's a win for the world. It's a win for the future.
It's a win for God.
It is a win for God. It is.
For God.
It is.
That's who I fought for.
Right. Tom, educate our listeners on how they can follow your efforts on a daily basis, because I believe it's imperative they do so. Because in following your efforts, they are following accountability and transparency, something they'll never get through the bought-off lamestream fake media or, frankly, anyone in government that I'm aware of.
Nope. One thing, listen, for all of my failures as a human being, one thing I am not is for sale. Please go to renz-law.com. It's renz-law.com. renz-law.com. From there, we're on Truth Social, we're on Getter, we're on CloudHub. There's a link to follow us there. It's at Tom Renz. Please follow us. I'm pretty active, especially on Truth. There's a Substack. I need everybody to subscribe. Please. We need subscriptions. I don't care whether you pay or not. If you do, all the money I raise goes to the fight. Everything I make goes to the fight until it's won. It's not won, and when I win this, I'll be on to the next one. So I'll take a few weeks in between, though. But support us there. We have a Give, Send, Go there. We always need funding. The more we got, the more we can do. I give because of the generosity of the people who supported us, I've been able to give away most of my time. But I can't ask other attorneys who need to feed their families to work for free. So, the more we got, the more we can do. And please send us prayers, first and foremost, always. But please help us get the message out. That's the most important thing. The reason we win this isn't because I'm the best lawyer in the universe. It isn't because I do some magic or I'm some big shot. It's because we, the people, wake up. At the end of the day, I'm just a big mouth trying to get the word out. And whether that's in the courts, whether that's in the court of public opinion, whether it's the politics, it doesn't matter. At the end of the day, it's me sharing truth that makes a difference, and the more people that hear it, the better. So please, please, help me get it out everywhere.
Tom, your Substack address again.
TomRenz.substack.com. There's a link on renz-law.com to get there. I'm looking at, so I do all my own stuff.
Right.
I'm looking at bringing in a person to help get some of that together so that I can do a lot more of it.
Great.
And putting it out right now, we put it out either every week or every other week. I'm going to try and make it more often coming up. We're just trying to get all that done. But said it before, I'm not a big shot with a giant firm. We're building the plane as we're flying it.
Right.
It's been a heck of a ride, and we're working on it. But the support I get and the evidence we can share is critical. So any support we can get and any followers we can get is great.
Tom, I'd like to thank you for your perseverance, dedication, and sacrifice on behalf of every person of our country and every person of the world. My dad's favorite statement was, dream big and dare to fail. People say, no, you mean dream big and dare to win. No. Here's what he said, and it goes back to something you said earlier today. He said, if you just dare to win, you don't leave it all on the field.
Nope.
But if you dare to fail, you'll leave it all on the field.
Nope.
And that's exactly what you have done, Tom. You have dreamed big, you have dared to fail, and then in the process, you've helped billions of people around the world with accountability, transparency, freedom, liberty, and their health care freedom. And I thank you, Tom, for everything you have done, are doing, and will do.
Praise God for anything I've done, and I've tried.
I know, and you will continue, and you and all of us will win this, Tom. And we thank you.
I look forward to raising that beer with you.
You got it. Folks, I thank you for joining us today. Until next time, Dave Janda signing off. Dream big and dare to fail. Thanks for joining us today. Share this video.